how are you doing today?
Good.
My name is John Smith. I'm a student physical therapy assistant, and I've been asked to come in and work with you a little bit today.
Okay.
Can you verify your name and date of birth for me, please?
Susan Smith, February 17th of 1990.
Okay, Susan. How have you been doing lately?
I've been okay.
Just okay?
Yeah.
What's going on?
Sometimes my back gets irritated with some of the activities that I've been doing.
Okay. What activities make it worse?
Doing laundry, putting the groceries away.
Okay. That's actually kind of a perfect segue to what we're going to be doing today. Okay? Because we have those activities that we have to do every day, but what I've been asked to do is come in and teach you how to do those so we won't hurt your back. Okay? So we're going to go over something called a power lift or a half squat lift. Okay? We'll go through this a little bit more in depth, but before that, have you ever heard of a term called a neutral pelvis?
I haven't.
Okay. So if you think of your pelvis just like this, you can rock your pelvis back and forth. Alright? So what I want you to do is I want you to kind of grab those hip bones right in front. Okay? You can feel those, and then if you slide your hands right around back, you can feel those hip bones in the back too. Okay? So that's what I want you to focus on as we try to figure out what our neutral pelvis is. Okay? So what I want you to do is I want you to kind of just hunch forward, get really bad posture. Alright? Can you feel how your pelvis rotated?
I can.
Okay? Now I want you to go the extreme opposite. Stick your chest out like you're proud. Alright? Can you feel how your pelvis goes back and forth doing that?
Yeah.
Okay, so what I want you to do is I want you to try and find right in the middle. Okay? So that's what we call a neutral pelvis. So the key to this is that we want to maintain a neutral pelvis when we're doing this. As we squat to pick this up, we want to do just a slight anterior tilt. So you're going to just tilt back just a little bit. Alright?
Okay.
The other key aspect, this is why I brought my lovely cane along with me, is I want you to make sure you're keeping a straight back.
Okay.
Alright? So this is just a tool we're going to use to figure out how to do that. I'm going to have you hold with one of your hands in the small of your back and the other just right behind your head. So you can see how everything's touching. Alright? Now if I hinge at my back, my hand comes off. Right?
Yeah.
So we don't want that. We want to keep everything touching the cane. So we're just going to make sure that we're keeping our pelvis in neutral, our abs tight, and then we're going to make sure that we're keeping everything touching. Alright? I'm going to hand this to you. We're going to try that just really quick. Perfect. Alright. So, now comes to the big part. Okay? Go ahead and have a seat again. We'll go through this in depth.
Okay.
So our steps are we obviously have to approach the object, right? Okay. So we're going to approach the object, we're going to keep our feet parallel, okay? We're going to keep our spine straight like we just practiced, okay? This is where that slight anterior tilt comes in, all right? And then a half squat. So as you can see in the picture here, this box is up on a stool. We'll put it on the stool that I'm sitting on here in a second.
Okay.
So that we're not lifting it straight off of the ground. And then you're going to grasp the object securely. If you can get if it has handles, awesome. If it's underneath, whatever you can do to grasp it securely. And then you're going to use your legs to lift.
All right.
Okay? Do those steps make sense?
Yeah.
Do you have any questions on them?
No, that sounds
Okay. Can you explain to me what you're going to be doing while I get the box ready for you?
Okay, I'm going to approach the box, and I'm going to keep my feet parallel and my back straight, my head facing forward, and then I'm going to squat down, making sure I keep everything where it's supposed to be. And then I'm going to securely grasp the object, and then pick it up with my legs.
Perfect. So let me demonstrate this once for you, and then we'll let you have a shot at it, okay? So you're going to come up to the object. Remember, you're going to keep your back straight, keep that neutral pelvis. You'll go slightly anteriorly, okay? You're going to come down to a half squat, pick it up, okay? And the same thing goes with when you're setting an object down, okay? Because you're not going to go around all day carrying a box. You've got to set it down sometime, right?
Yeah.
So the same thing when you go to set it down. All right? Okay, do you feel safe giving that a try?
Sure.
Okay. Perfect, and back down. Awesome. Any questions on that?
No, that felt pretty good.
Okay, any pain in your low back with that?
No.
Okay, so this handout is for you to keep. So as you try to do things at home, you can refer back to that, and if you have any questions next time, we can go over those, okay?
Sounds good.
All right.